On this episode of the Physio Foundations podcast, I'm going to talk to physiotherapist Vasish Vasan about his experiences transitioning from being a student to working as a physiotherapist in a successful clinic alongside doctors and other professionals. And I'm going to ask him his tips for getting the most out of this phase of your career. Welcome back to the Physio Foundations podcast, where we talk about the knowledge and skills that provide the foundation of expert clinical practice. So on this week's episode, I'm talking to a former student of mine from Monash University Physiotherapy, Vasish Vasan. So Vasish is now a successful physio. He's building an impressive clinical career in Melbourne, Australia, where he lives. And Vasish is an athlete himself. He plays elite cricket and football, and he's also a physiotherapist for the Blackburn Football Club, where I used to live in Blackburn. And he works out of Sports Med Biologic, which is a clinic in the eastern suburbs of Melbourne. And you may recognise that name as Susanna's clinic. So he works alongside my wife, Susanna, who you know from the podcast. So that's how I know Vasish. I'm not going to do the full bio on him because he's sitting here with me right now. So I'll get him to tell us more about his background. Vasish Vasan, welcome to Physio Foundations.
Thank you very much, Luke. And good day to everyone listening from Physio Foundations. Thank you for having me.
It's good to have you here because you've obviously a former student, and I've known you since you were in first year undergraduate studies, but now you've gone places and you're doing some interesting stuff, and I want to share that with the world. So I think we can all learn from your journey in this transition from really successful transition from student life to working life. So can you tell us a bit more about yourself and your training and interests and who you are?
Yeah, I was very fortunate to go through my undergraduate studies at Monash University with Luke himself. Finished in the year of 2020 through COVID. So it was an interesting last few years of university, but transitioned. I think university, led us in really good stead for hospital work. And I finished university thinking, geez, I quite enjoy the hospital stuff. I did a little bit of AHA work at the Alfred Hospital when COVID sort of erupted. And I really, really enjoyed that part of the work. But I think deep down, as Luke alluded to, I loved my sports all growing up. And I guess when I finished school and I thought, what do I want to do when I grow up? It was very much, I want to do something related to people. I want to do something related to some body medicine, something like that, and something related to sport. And the job that potentially tied them all together was physiotherapy. So I guess keeping that in mind, I thought, all right, I need to go down the private practice route to get myself as close to a sports physiotherapist as I possibly could. But I guess that's how my journey sort of went from university to thinking of potentially hospital. I applied for a few hospital jobs. I went, had a few interviews, and I thought, is this really for me? And I went, probably not for now, and went down the private practice route, and that's when I started at Sports Med Biologic.
So the AHA you mentioned is allied health assistant work, and then you enjoyed the hospital work. So your clinic is a medical clinic. It's a really good private medical clinic, and you work really closely with doctors and other professionals. I'm interested in there. You didn't necessarily work in the hospital, but you had an interest, and you could have done that. How does that interest in the medical side of things help you in this role, in what you're doing at the moment in a medical clinic working as a physio?
I think that we talk about like interprofessional communication and involvement. I think that was probably the biggest thing. Having physiotherapy, as I'm sure all are aware, can sometimes be quite an isolating job. You're in a 4x4 room and you're with your client, but the reality is it's just you and your client for most of the time. So I think working in an environment like a hospital where you've got doctors, nurses, other allied health staff, the whole heap, I found that quite engaging and stimulating, that you always have someone to speak to communicate with. You've got ideas to bounce off. I found that quite enjoyable. And I guess in that same vein, at Sports Med Biologic, it's nice in that sense that, there are people there, experts, absolute geniuses in their field, to run ideas off and to chat with and to talk about pathology and things like that, where you're not just in an environment where it's you, your client, and the door in your room.
Yeah, so you've got orthopaedic surgeons, doctors, a nurse, a podiatrist, other physios. So what's it actually like there working with them? So you'd still do the one-on-one treatment. I know you've got a gym there, and Susanna often sees you there in the gym working with people. I want to ask you about that as well. So what's the the osmosis of, that transfer of information that you get informally and passively sometimes. What's that like? So sometimes you'll see people in the corridor. Sometimes you'll go and knock on a door and directly ask a question. Tell us
Yeah,
about that. What's it like?
yeah, I think the one really nice thing, is the patients, I guess, get a really nice rounded care. So what that essentially
Yeah.
means, they, go from whether it's physio to doctor to podiatrist or doctor to physio to whatever the routine is. But as a result, it's quite nice for us because, say, doctors referred a patient to me, I can just, I'll go knock on their door. So and so's in the room with me. What are you after? What's this? What's that? And I sometimes probably come across a little bit of a pest in the clinic, going and knocking on everyone's doors and asking questions. But that's the really nice thing. So you can anytime I'll go to reception, or does so and so have a little break right now? Perfect. Then you knock the door, you ask a few questions, and obviously that leads to other conversations, right? So I ask about Luke's knee, this, that, and then that might lead to something else about some recent clinical trial that finished about a knee that's great. And it's a really nice, for me being so early in my career, a lovely opportunity to keep learning, which is, I think that's probably the biggest part of being for the clinic, selfishly, is that you always get to learn, and there's unlimited learning opportunity because of the caliber of practitioners you're learning with.
You call it selfishly, but then if you weren't doing ongoing learning, that would affect everybody. The quality of your care would drop. So you enjoy it, so you call it selfishly, but it's actually really important to do that. So knocking on doors, being a pest, I'm sure that, honestly, as someone who's got a lot more experience, looking back on 20 years of experience, the people who ask questions and knock on doors and are interested are much less of a pest than the people who don't show an interest. I promise that. So on that then, how do you feel people respond to having a new grade physio who's that interested, engaged? Do you feel that you build rapport with other professionals by doing that?
Yeah, I think there is definitely that. The more interested you come across, the more experienced clinicians, colleagues, I guess now they do definitely take you on board a lot more, and that is nice. But it's sort of that. It's a difficult one. I think I found that quite challenging at the start because you want to ask a lot of questions, but at the same time you're working in a very esteemed clinic, which means you can't necessarily show too much vulnerability at the same time because you do kind of need to know your stuff in the same light. So I think that was a little bit of a challenge of what questions should I ask and what questions should I actually just go back to the books and look up myself and really teach myself that way. As I've been there for 3 years now, I've gotten better at that, knowing, okay, I know the basics. Now I can probably ask a few of those more complex questions, and the other questions I probably can get away with not asking. But that was definitely a challenge at the start for me, that, all right, well, if I just ask this, what am I going to come across as really stupid if I come and ask this question? And then that credibility or trust that I've got, is that just going to be diminished in one go? So that was definitely something that I thought about a lot initially. Every time I would go and knock on that door, there'd be 3 minutes of me sitting in my room going, oh, how should I ask it? What's the best way to ask this? Like, am I going to come across stupid? Like, surely I should know this. Did I learn this at university? And there'd be that constant, internal dialogue before I actually would get up the courage to be like, oh, I will go and ask this, because at the end of the day, it's not really about me. It's about the patient in front of me. And if it's giving them the best care, then I was like, well, I can suck up my pride or whatever it is to ask.
So how many of all the many times you've asked, how many times do you think you've regretted and been embarrassed by asking a question? Maybe a percentage of them.
Very, very, very small, to be honest.
There you go. There it is.
Probably, yeah. I think I can only remember one incident that I actually went, oh, no, I probably shouldn't have asked that, because as soon as you told me the answer, I thought, okay, I actually definitely knew that answer.
Which you can get around by saying, okay, I should have known that, and you can laugh it off. Exactly. So a very small percentage of the time you've been actually embarrassed, or it's actually you felt like it's undermined any sort of credibility, and the rest of the time it's just added to your rapport and the understanding that people you're working with know that you want to learn and you're moving forwards. That's come up again and again in these new grad series conversations I'm having, that breaking through that barrier of being afraid to ask has been rewarding. It's been worthwhile.
Yeah, absolutely.
So coming into this role, it's fair to say that this is not, your average new graduate role because of the nature of it. You're working alongside doctors, really well-known doctors and surgeons. So how did you feel like you were positioned when you came out of university for a role like this? And I guess the double barrel question would be then, so how did you then prepare and get yourself to the starting line so you can work in this, it's not high pressure, but a high quality, really well-known clinic in this pole position, in a really good position that you're in?
Yeah, I mean, fair to say, I was not prepared at all. University teaches you a lot of things, but I think probably the one limitation in our probably university model is probably towards private practice and how it sort of transitions to private practice. Maybe that was a byproduct of doing our last few years within COVID as well. But there was definitely a sense of, okay, geez, I'm really out of my depth here. The job itself came across really, it wasn't something I applied for or anything like that. I happened to just send an email to a clinician about a bit of sports trainer work or something like that. And then that led to a conversation that led to a few more conversations. And all of a sudden, I'm working there in a small scale. And then across the last 24, 36 months, that's just grown and grown. So it was very much, it just fell on my lap. And I thought, well, how good's this? I have to take use of this. But to answer your question, I guess there was nothing really that I felt could prepare me beforehand, except for just jumping in and going, well, I'm going to have to, it's a sink or swim sort of mentality. And I was like, well, I have to swim. I've got to find a way. And whether that was being a pest, whether that was just doing a lot of reading and asking questions, I think a lot of reflecting on the patients I saw and what I did with them, because coming out of university, the hardest thing is it's that 30 minutes or 45 minutes, whatever it is. It's a pressure environment. You're there with the patient who's paying a lot of money, expects a lot of results. You're in a STEAM clinic, so they're expecting a lot from you. And at times you give them what they need, and times you're not going to meet all the expectations. So it was a lot for me initially. I'd go home, I'd reflect a lot and be like, okay, I did X, Y, Z. Where did I go wrong? What could I have done better? And that, I think, helped me quite quickly in terms of getting a bit more confidence to be like, I've been through this before. I've gone to that stage where I was trying to explain pathology and I butchered the explanation. So how am I going to go about that differently next time? And I think that initially doing a lot of that helped me prepare myself better.
Yeah, that process of reflection is just essential, isn't it? Lots of reading, lots of asking questions, but that's a really good honest answer. Because like you said, you're in a STEAM clinic, you're doing really well, but like everybody else, you went in there feeling a bit unprepared, but you did it anyway. You jumped in there and made a start. And I guess this episode is really aimed at students and grads who are maybe a couple of years out.
Yeah.
But hopefully anyone else listening to this will find it interesting as well. What sort of tips could you give students or new grads who are in the same position as you, who are want to get that dream clinic role, or they want to do something what you're doing?
I think it's definitely a reach for the stars. I think you're always going to be underprepared, always going to feel underprepared. So I think when you're applying for jobs or having conversations, you should never limit yourself to going, I'm just a new grad, or I'm just first year or second year or third year out. I think you reach for the stars, and look, if it's up to the person interviewing you or deciding to make that call. And if they don't want to, if they think it's a bit of a risk, that's on them and it's not on you. So I think at the end of the day, it's about really you doing it all what you can do to put yourself out there and know that it's going to be a bit of a sink or swim mentality. However, if you put yourself in a good enough position, you'll find a way, and you just got to trust the fact that you find a way.
So Susanna tells me you've got clients there in the gym. She often sees you there with clients in the gym, and you've got a sporting background. So you've played football, you played elites, premier cricket, and you've got an interest in sports. How did you get from undergraduate training to that level where you're taking clients into the gym and you're not only doing your rehabilitation, but you're doing I guess you're not only doing your assessment and your stuff that you could do in a consulting room, but you're also doing rehabilitation in the gym. What additional training did you do, or what of your own skills did you use? And
Yeah, I think a lot of I did a bit of sports trainer work when I was in university, and it was a great role. I was in a soccer club, but I was the only one there, and there was no physio, there was no one else. It was literally just me, and the team would often come to me as I was a graduate physio, which I definitely was, and I had no idea what I was doing half the time. But I think what it taught me was a bit of creativity with rehab and things like that. Okay, well, he's going to move from X to Y. How many different ways can we get him to move in that direction, trying different things? And I think those skills over the 3 or 4 years as a sports trainer, where I was just like, it's me and a paddock and I have to make up whatever I've got to make up, with no real background in knowledge. I think that quite helped me, the creativity of those skills, to then go into a rehab setting and be like, well, now I know actually what the objective is. What are different ways I can get them there? I think that was quite helpful for me personally. But the gym, at SportsMed, a lot of the clientele we do see are athletes. And initially when I got the job, my role was purely around a rugby club that I was looking after. So a lot of that, if you're being really, I guess, true to the clinical research and the guidelines out there, if you're getting a patient back from a hamstring, you've got to put them through the tough work, and that happens in the gym. So I found that it was a combination of knowing, okay, I had to do that and finding different ways. And then from a learning perspective, I think what was actually really helpful is heaps of social media videos out there with rehab things. So you can, as long as for me is like, I know what I need to achieve in this rehab session, there is a plethora of stuff out there, right? From Instagram and this and that, and all the physios all around the world that, and S&Cs that put their stuff out there. So sort of just pick and choosing different parts of that and going, okay, perfect, I know what I need to get done. Okay, yeah, that looks right. I'm working a bit of eccentric strength here. I'm working a bit of high speed running here. And you're sort of putting those things together until all of a sudden you've got your own little model yourself.
Yeah, that's good. And it's fair to say that some people are afraid of the gym. If you haven't been there, and it can be an intimidating place to train in yourself. And it's something that other physios have told me and students have told me, especially if you don't have that personal experience from a sports background or a rehab or training environment. Chris Seville's been on the podcast a few episodes ago, who is a power lifter and a strength trainer and has that background. But it's really interesting to talk to you about that, because that was essential for the role. It wasn't, even if you didn't like the gym yourself, you're rehabbing someone's hamstring, someone's ACL. The guidelines, the evidence say this person needs a baseline level of strength before they progress through their rehab. They need to be in there. So you need to develop those skills. And it's interesting just how much stuff is available now just to get you started. Everything, like you said, from Instagram, which is fairly unfiltered. It could be anything, through to courses that are available as well. Yeah. So there's plenty of options there. Yeah. So let's talk about what you think the most foundational knowledge and skills are for a physio. This is from your perspective. You've been out for 3 years now. It's your third year working as a physio independently, reflecting on your education, but also everything you're now using in the clinic. And you can go anywhere with this. Yeah,
I think it's maybe a bit of a cliche answer, but I think communication by far is the most important foundation skill. You can know everything in the world. You can know every complexity of pathology, but if you can't explain that to the person in front of you, well, it's as good as nothing, in my opinion at least. So I think that was the real not challenge, but part of the learning, the steep learning curve for me initially was to go, okay, well, I know all these things upstairs. I know what a grade 2 hamstring, I know what this is, I know what that is, but the person in front of you doesn't. And to be able to sit down and really break it down and explain to them in a way they do understand, I think that is the most challenging thing. And that feeds into all the other aspects, because you can't, if they don't buy in, they don't understand, well, you probably can't do a good job, because you're not really going to be able to take them through all the stages of rehab or anything like that. And then, even going from a commercial sense, if they don't understand why they're coming in, well, then you're, rebooking and all the other business aspect of the physio, that's probably not going to go so well either. So I thought that's probably the main fundamental. I think university, everyone jokes about fake it till you make it. And it's a very fair line. It's probably not the most appropriate line, but it's a very fair line in the fake it till you make it. But a big part of that is communicating, to go, okay, there are things I don't know. And I think I've learned probably more recently than when I first started that patients actually don't mind when you go, okay, I'm thinking this and this. We're going to do this to figure if it's this, or we're going to do this to figure it's this. But this is what my thoughts are. I'm going to be nice and open and transparent with you. And they walk away and go, actually, well, he actually knows something because he's telling me this, he's telling me that. They both seem about right. I'm on the same page as him. Rather than maybe 2 years ago when I started, if I had said that, I'd be like, this guy thinks I'm clueless. So I think part of that, communicating what you're thinking, most often patients appreciate that honesty and transparency. So I think communication is probably by far the most important in our role.
There's a level of confidence that you need just to function. And so when you're talking about fake it till you make it, that's in contrast to what you just said about being very honest and involving the client in your decision making and saying it could be this, could be that, there's some gray area, this is what I'm thinking.
Yeah.
Let's see how this goes. And people appreciate that. So fake it till you make it. I mean, where do we draw the line between sort of at least starting with I'm going to start with some sort of foundation of some confidence and I'm going to turn up and be here versus when you say I'm not sure?
Well, I think with a lot of, let's say acute presentations that come in physio, there are always something you can do to make them better. And even if I feel have zero clue what you're doing, I think that if you're on your confidence, you reassure them, you give them encouragement, and you point out a few comments to say, old mate comes in, I have difficulty walking down the stairs at work. We've got an elevator there. Well, even just telling them, okay, well, for the next 4 days, we're going to use the elevator. Might seem common sense to us, but often is missed in general.
You may not need a physiotherapy degree to come up with that idea, but it was what you're saying is the power of stopping and zooming out a bit, detaching and saying, hang on, what do we really need to do here? We need to settle this knee down.
Exactly.
Let's do it properly.
You might have a clue what the actual knee diagnosis is, or what you're going to really do about it. But then at least you can point out a few things that are going to help the person. So they walk out of there going, okay, actually, I got a bit of value out of that session today. And that's probably the fake it part.
Which is the antidote for overthinking, which can be a killer because we've got complex things to think about and you can definitely overthink things. And you might do all this complex stuff and the person's still taking the 4 flights of stairs every day.
Exactly right. So
we haven't thought of that.
Point. But then I guess the next stage, I think where you say draw the line is as soon as you finish that fake it till you make it and you're like, okay, I've given them something and they're happy or whatever, I think that's when you really have to, if you're being honest with yourself, you probably have to really go and do the research and think about what you could do better, all that sort of stuff, so that next time someone else comes in like that or next time they come in themselves, you're far better prepared for it. So I think that's where the line gets drawn of maybe, the first instance where you meet someone, something's thrown at you that you're not quite so sure with. But as soon as you get another opportunity at it, I think you have to give it a better crack.
So it's that balance of getting started without waiting to know everything, because then you'll never get started.
Exactly.
But also having that process, having that willingness to reflect and read and be humble enough to say, I don't know, and ask questions. Yeah. It's a real balance that's going on there.
Yeah. And I was probably really lucky in the role that because the doctors are there, that anytime I do get a little bit out of my depth, I can refer on, which is a really nice thing. And I think I was a little bit, initially I was a bit scared to refer on because I was like, oh, does that mean I don't know? But then a lot of the times now I refer on quite quickly to podiatrists, exercise physiologists, even other physios in the clinic, because I go, well, if it's their area of scope, at the end of the day, it all comes down to the person in front of you is the most important thing. So you're trying to get them. And if you tell them, I'm trying to get you the best possible care and I think I'm not the best person for it, or I think, the sports doctor or the physio down the hallway is, they're always going to appreciate that. So I think that's why I've sort of gone now, okay, I'm happy to refer on or admit, because at the end of the day, if you communicate that well, they'll still love you.
Yeah. So it sounds like explanation as that part of communication, being able to explain things, why you're doing them, what you're doing and what you're thinking is a really key part of your foundational skill at the moment that you're using, or skills. So what about being a patient yourself? So I happen to know that you've had a knee injury you've been telling me about, which happened, was that the day before your first placement in third year? You did your ACL.
Yeah.
So there's going to be a lot of learning that you got from that experience that you directly use every day in the clinic from a patient's perspective. makes you more empathetic and knowledge directly that you'll take into the clinic. So do you want to take us through that? What happened?
Yeah, well, I mean, I was playing football, little marking contest, probably the first contested mark I took all year. And I got pushed in the air, landed hyperextension, ACL, medial meniscus, MCL, the unhappy triad as they call it. And I had my first placement the next day. So I remember thinking, oh no, this is not good. And I had 15 weeks straight of placement coming up. So I had to jiggle a few things around, and I avoided, well, I didn't at the time. My surgeon was like, you're going to have 6 weeks in a hinge knee brace. And I was like, well, that doesn't sound too fun. And also that means that's probably going to impede the way I finish my placement. So I thought, all right, I will do 5 weeks of rehab. I'll get my knee somewhat functional, and I'll finish my placement. I'll come back later in the year and do the surgery. But in that time, I was really lucky to see Jane Rooney, who's a really, really esteemed knee physio, but a knee specialist in that. And from not only learning of what she taught me as we were going through the ACL program, I really did get an insight of what it is like to be a knee patient. And I was at times I was a really good knee patient, and times I was a terrible knee patient. And I think the biggest thing, it really shed light on the fact that rehab sucks. And no one really enjoys rehab. Like sometimes when you dangle that goal in front of you and you're like, okay, I need to do X, Y, Z to get there, people might be a bit more motivated, but for a lot of the time it is draining. It's not what you want to be doing. You want to be playing sport. You want to be doing the things that you want to be doing. So I thought that was a real eye opener for me to go, it's actually not as fun as it, us physios get really excited about how good's this, you're doing, the hamstring curl today, you're doing this tomorrow. But reality is it's not that fun. And a lot of the times the patients, they're not enjoying that journey. So I think that grounded me a little bit when I do talk to my ACL patients now and I say, hey, look, you're going to have some shocking weeks. You're going to have some weeks that you just hate the gym. You hate even thinking about your knee. You're going to have weeks that you're a bit more motivated, and going through that roller coaster of rehab from a mental perspective. I thought that really was probably the biggest learning curve in that whole, except from the bits of the wisdoms that I got from Jane herself. That was probably the biggest learning for me to go, it is a paradigm where it's not constant. It's definitely not linear. We're going to have some really bad periods. So understanding that, and I guess now in practice, telling patients at the start, like, just please communicate with me. A lot of my ACLs, I'll give them a week off periodically to sort of go, just sit back, relax, watch TV, do something else other than rehab, because losing 2 sessions at week 20 is not going to be as bad as you burning out by week 28 and
quitting completely. Yeah.
So things like that I've sort of learned, and I have that. And like, be honest with me, if my program's too long for you, or if I'm getting you to do too much, just let me know. Say I'm not enjoying it. Tell me that, rather than just not doing it, because I'm more than happy to meet you halfway rather than you meet, because I can give you gold standard every time. But the reality is no one really wants to do gold standard. And gold standard is like elite athlete that are getting paid to do that. So a lot of the time,
important. Yeah, that's important to remember. I've interrupted you.
No. I think
that was good.
The end of my point anyway. But yeah, that was probably the biggest learning. And then obviously the knee specific stuff that came of it. But I was actually quite lucky. Avoided surgery in the end. Had a really nice outcome conservatively. ACL re-healed in an MRI, which was nice. 18 months post. So knee stuff's going well for now. Touch wood. But
you're one of those lucky people who had a spontaneous healing.
And sort of before.
Amazing.
Before, I guess, the newer research has come out, which is
but it's funny because you didn't go ahead and I'm going to try to spontaneously heal. You just, as the name suggests, spontaneously healed.
Something, whatever I'm eating, whatever mum's cooking.
And also you probably weren't, I imagine you weren't early on hammering the extension. You probably had a little bit of flexion deficit there. And so I'm sort of thinking, because Jane's such a good physiotherapist. I saw Jane present a couple of weeks ago with Dr. Tom Cross and Stephanie Philbay and Adam Colviner and Brooke Patterson. So all these people have been lucky enough to work with over the years. And they were talking about the cross protocol, which is it's a really important point to make here. This is pre-clinical trial. So it is just proof of concept. Well, not even proof of concept. It is just case series of people. It's just interesting. So definitely physios, other professionals, do not go and do this. Work with your sports physician and find out more about it. But
Yeah.
the patients in that series of case studies were braced at 90 degrees, and the idea being that would approximate the stumps of the ACL,
Yeah.
and bring it close together and facilitate some healing. And Dr. Tom Cross presented a whole series of MRIs of patients before and after showing the healing of the ACL. And it was fascinating, paradigm shifting stuff.
Yeah.
And what's really important, public service announcement, don't just go and stick people in a brace at 90 degrees because they all need to be on anticoagulant therapy, because there's a risk of obviously clotting, and if you have your knee flexed for that long, so for many weeks on end. But it's something to really watch this space. And then so Tom presented a series of stories and MRIs of people like you who had spontaneous healing, and it's fascinating.
Yeah, it's definitely, like, a lot of patients do come in, my ACLs, and they sort of go, what was your journey? And I tell them, please do not listen to my journey, because I cut a few corners, and I wasn't, like I said, I was a good patient at times, and I was a very ignorant patient at other times. And I thought, I'm a physio student, I know what I'm doing. And I definitely cut a few corners that I probably regret. But it was very much, as you alluded to, with that concern, I think there is still a little bit of room to go in terms of which patients are the best candidates, which aren't, things like that. So it's
non-surgical. We shouldn't call it conservative, should we? Non-surgical management, because there's it's pretty aggressive, the rehab that you need to do.
Yeah.
So absolutely. You and Jane did a lot of rehab.
Yeah, a lot of
which
rehab.
At the time was prehab. You were thinking, I'm going for surgery.
Correct.
And then you went and played a game of footy for.
I played cricket. Yeah.
You played a game of cricket, and it went well.
Went well, scored a few runs, and I was pretty chuffed. And I thought, well, this is actually moving all right. And I remember thinking, like, to shed a bit of light as to how underprepared I was going into that game of cricket. I hadn't really done any running between the wickets. I'd done a little bit of agility work, but that's about it. And then I was out there, quick single off my hip, and I ran. And I did a quick 2, and I was like, this is the first time I'm turning at real pace with pads on. And I thought, oh no, my knee, what am I doing here? But it worked well, and I guess I've had a pretty lucky outcome in the end. But like I said, I'd probably change a few things I did.
Do as I say, not as I do.
Exactly right. As most physios.
So you were out there running between the wickets, and you realise, it's the first time I've changed direction.
Yeah. It's the first time I've changed direction at pace with studs on. And there was a few things, even like a pull shot when you're pivoting on your back leg. And I was like, I probably haven't played many of these, leading up to this game. I was on the back of sort of 2 training sessions. I'd change a few things. However, the good thing though was there was always in my head, there was a bit of I'm going to get surgery anyway. Which is probably a bit of a naive thing to think, but worked out all right. And it gave me a good learning of what to do and what not to do. And also understanding at what point of the journey that people potentially start to cut a few corners and go, I'm a bit over going to the gym. I want to sort of get running. I want to, all of a sudden footy's in front of them, or, any sports in front of them. They're like, I could probably just shoot a few hoops, or, I could kick the ball, and all of a sudden you're in match sim, and things can escalate quite quickly when you're in that sporting environment. So I thought it was a good learning insight into when do you really have to tell the person, hang on, you are actually risking a lot here by letting these enthusiasms go ahead a bit too much.
And they may not realise, because with all your training and your insight and seeing a really good physio, it just happened. You suddenly found yourself running between the wickets. And
exactly. But I don't think I even ticked it off with Jane, to be fair. I think it all just happened, and there you go. And I don't think she was too chuffed, but that's okay.
These things happen. But this is really important. This is your real insight here, that from being a patient, so you don't have to injure your ACL to be a really good physio. There's no doubt that you can always contribute something. But your unique insight here is, as you said, rehab sucks. Yeah. There's a big psychological component to a long-term rehab. Yeah. And these are human beings. These are people who are going to have bad weeks and good weeks, and just leveling up with someone and saying, hey, when you need a week off, you do that. And we need to get you through 12 plus months of this. So having a couple of sessions off isn't going to be as bad as stopping.
Absolutely.
It's a really important insight. Yeah.
Yeah, and what you're saying before about getting people in the gym, and which I really, really do enjoy, and especially the ones that haven't been to the gym before, or what I find is there, as a physio, you get great satisfaction from treating an injury and having a successful outcome. My knee pain's gone. That's great. But I think what I get even more satisfaction from is the real lifestyle changes you can make. Someone that's never stepped foot in the gym and therefore has been reluctant to do XYZ exercise, that all of a sudden, because of the rehab they've done with you, they come back for another injury, or they just send me an email going, hey, just to let you know, I've done 3 months in the gym and I'm going every morning. I love, like, I go to this class and I have a few girlfriends that I do this with, or whatever it may be. That's, I think, the really enjoyable aspect of the job, when you can make some really nice lifestyle changes that will protect them from other injuries going forward as well. So that's definitely the gym aspect of it. It's to, one, obviously get them through their initial hump, but can you give them something they'll actually enjoy that will make it stick going forward?
Gold. Where do you see the physio profession going from your unique view? And from what you do and what you're doing, where do you see us going over the next decade in terms of the profession?
That is a really good question, Luke. I think
I've thrown that one in there just without any planning.
I think there are definitely challenges ahead. I think, and I'm sure a lot of new grads listening to this would understand where I'm coming from, where the business aspect of private practice physio is a really difficult thing to grasp. And, when I was in fourth year university, they just brought in a business unit that helped to an extent, or just, I guess, encouraged a few of the new ideas. But the reality is, it's not a business degree; it's a physiotherapy degree, which means that you're really, really underprepared for that part of it. And I think that's speaking to a lot of my friends that I graduated with, even to this day, that's probably the one thing that we all grapple with the most, of that business side of physiotherapy and private practice physiotherapy. And I think as maybe society's changing a little bit post-COVID as well, there is definitely certain challenges with how people want to spend their money, cost sensitivity. Obviously, I don't need to go into how cost of living is going up and all that, but I think that's a really challenging aspect of it that will influence how physio looks in 10 years' time. Now, I don't know if that makes it better or worse, but I think that's definitely something that's a model, kind of, depending on which way that goes, and how new grads and how younger physios warm up to the business side of things. I think that'll sort of determine how well the profession moves forward in the next 10 years. I don't know if that's...
And this is talking from a private practice, and probably more so from an Australian private practice context, because there's different models around the world. But that's an answer I haven't had before. Thinking about the business and the financial cost of living side of things, that's really important, because there's certainly a lot of people out there who would love to see you as a physio and probably need to see you, but can't afford to as well.
Yeah.
And that's not saying anything about fees. We're all charging, let's say we're all charging the same amount in the private context. It's just the cost of living pressures are real out there. And so, making a model of care that's affordable for people is a separate topic, but that's an interesting answer to that.
Yeah, there's pressures both ways, right? So you're obviously, we've got business owners. At the end of the day, is the business. So business owners have to think about their side of things, and then as practitioners, you got to think about your side of things, and then as patients, they've got to think about their side of things. So you've got three different, I guess, interests, or areas of what's important to them, priority levels, and you're the ones probably stuck in the middle, thinking, I've got to bring this all together and somehow make this work. So I think that is definitely a really challenging aspect that even to this day, there are days where I do it well and there are days that I don't do it as well. But I think that's probably the one that, for probably physio students listening, if you are potentially thinking about embarking in the private practice journey, I went to different physios in my fourth year. I spent time shadowing. I spent a little bit of time in Quick Victoria with Paul Visentini at Physio Sports Brighton. I spent a few time with, obviously with Jane through my ACL journey. I did that, and I guess that gave me a little bit of pre-context of what private practice physio looks like, because the reality is you just, until you land in it, you're not going to be really prepared for.
Even on private practice placements.
No, and I think, as
a student,
actually, I should say, because of COVID, my private practice patient got cancelled. So that was probably a limiting thing for me. But
limiting, but then if you think about that, look where you've gone.
Yeah.
So it doesn't limit you. It makes it harder though. So you had to do a lot of stuff to make up for that, given where you wanted to go, spending time shadowing, learning from people.
Exactly. And it was a few emails, right? It's nothing fancy. I think for anyone out there, you literally go onto a person's website, you like what they do, you get their email address, you send them a nice email, you say, hey, I'm a fourth year student. I really, enjoy looking at what you're doing. I'd love to, if you have a spare hour or two, or if you have, could I come and shadow? And I'd say 99% of the time, unless there is something, I think one time one physio was like, I'm on leave or I'm going on a tour here. Every other time they were like, absolutely, we'd love to have you down. Like, come spend a day at the clinic, see what it's after. And they were all really good with that. So that's the one thing I'd absolutely encourage. If you ever feel like, hey, I'm actually not really sure, just go and see for yourself, and you'll find the information out pretty quickly.
The quality of your email will make a difference there.
Yeah, definitely would. Yeah.
And your approach, the way you're going about that, you're not just doing it for yourself. You're talking of what you could offer as well. And then if you're a business owner, you're getting that email. It's really this guy or girl sounds really clever and switched on. I wonder if they'd be a good person to employ as well. And you're not taking up any of their time. You're coming in and perhaps adding some value and bringing some of your knowledge to the clinic. There's lots of reasons that could be a useful thing to have.
Exactly right. I think in one of my emails that I sent, I was talking about how the rehab side, elite sport, and I was like, unfortunately, as any university degree, I was like, we've got, there's a limitation with how much exposure to elite sport we've had. I'd love to spend, this is when I went to Cricket Victoria, and I sort of, pointed out the holes that I wanted to fill by spending a day or two there. So not just going, hey, I want to leech off you for a week. It was more, these are the holes that I've got. I'd love for you to give me the opportunity to fill those holes essentially. And Nick Adcock, who's the head physio there, he was lovely, and he was like, come on in. So I had a great time.
That's really valuable. There's a positive attitude underlying all of that as well, but there's also some strategy. You're not just talking about, I'd just like to generally be there and shadow you. You're talking about why that is. And here's where I'm going. This is what I'm doing. So where are you going? You don't have to know, but
no.
where are you going over the next sort of 5 to 10 years? What sort of courses do you think you'd like to do, and where do you think see yourself?
I want to tick off the whole sort of, I've done level 1 and 2 sports. I need to sort of go through that and hope.
So for overseas listeners, these are our Australian Physio Association accredited courses for sports, for physios. Yeah.
That hopefully are prerequisites for potentially doing a master's at some point in time.
Good.
But I think, I'd love to, the dream still for me is to end up in elite sport, whichever caper that may be. I still would really love to be there. And reason why I've got the sporting background, so I love sport in general, but I really enjoy the pressures of working in sport, having that sort of timeline. Like, you've got to get back in 2 weeks. It challenges me. Sometimes, a lot of physios will complain, or myself, about monotony in the job. But sport's a really nice way to break that monotony for me, because I get that aspect of player coming to me, coach calling me up. Great, I need him by round 3. I need him by round 6. Oh, he's a bit slow with his rehab. And I love those conversations, having those conversations with player and coach. I absolutely love them. I've been there from the player sense of, physios pulling me back, or physios going, yeah, you're ready to play. Coaches going, we need you early. So I sort of get it from all sides of the coin. And I really enjoy that pressure when someone comes in and their first appointment, they're like, okay, I've got this, but mate, round 1's in the 15th of April. Like, any chance we can get there? I love that conversation. And often the time it might be no, or might be, we'll see how we go. But just having that, because that person's already keen. He's motivated to do what he's got to do, or she, to get there. So I think it's a great starting point, and then you can really feed off that to get the ball rolling.
You love the pressure. See, that's important. And that's, Jody said that. That's come up a couple of times on different episodes, talking about that sports, and the intensity of a sports physio role. You have to, it's different things suit different personalities, don't they? Different roles as well. Hospital, private, different types of roles in physio. They definitely suit different people. You have to love the pressure.
Have to.
So,
And there are definitely times I don't love the pressure. I must admit there are, obviously conversations that sometimes, because you are, at the end of the day, sometimes they are over the depths. When a player, coach is grilling you at 3/4 time about a player that's just gone down, you're like, well, I've got actually no idea. Like, he's just gone down, and you're trying to really, think on the spot. Like, you're going to give him something, games on the line. But you're like, well, if I send him back on and he becomes in a 3-week injury, becomes a 12-week injury, that's on you. So there are times the pressure is not as friendly as others, but that's all part of the experience. And I think at the end of the day, as long as what you do and you have some rationale behind it, at least when you go home, I think one of my first boss told me, he was like, if you have to think about a patient or a scenario when you finish the day at night, you haven't done a good job. And I think that stuck with me to sort of go, okay, as long as I tick all the boxes, at least
not the reflection though.
Not the reflection, just from a sense of, could I have done, should I have done something different, or should I have escalated care, or that sort of thing. I think, if you've got to think of that and you're worrying about a patient at the end of the day, that's a bit of an issue. If you're reflecting, that's great, but the worry side of things.
There is a balance, isn't there? There is you can go from reflection to worry pretty quickly. So there's a distinction there anyway. Well, anything else you want to add? We've covered a bunch of ground there. It's really good, really useful. I would have thought if I was a new grad or a student listening to this and I'm thinking about positioning myself in a really good clinic, doing some of the things that you've been doing, and feeling the insecurities that we all feel, I would have felt that this conversation would be really helpful for me when I was a new grad, and all I can do is just do the things that I think are going to be valuable and publish the conversations I enjoy having. So I really appreciate that. Anything else that you did?
No, I mean, I think, I guess for me, just like a takeaway point just for any listeners out there, whether it be younger physios than me or students, is really just embrace, it's easy to say and it's really hard to do, but embrace the vulnerability of not knowing, because there is always going to be someone that knows more than you, but that's okay. And I think that's sort of understanding that, try to find your strengths and have a few, reflecting on what are you good at, because at least then you can go, okay, that's my strength, and you can hold true to that. But sort of embracing the vulnerability of, okay, well, you really university, Monash, I had a great time at Monash, and I really, really enjoyed the curriculum and the course, and I made some lifelong friends from it. But every undergrad in every industry, there are limitations to how well they can prepare you, because in the day, first day of work is first day of work. And I think you're going to be in the deep end, which might sound a bit over the top, but you are going to be in the deep end, and just trust that you'll find a way at the end of the day. And it's not going to, you have one bad day, so be it.
Brilliant. I find that inspirational and helpful. At my stage of the career, I'm sure other people will as well.
You're an expert, Luke. You don't need this advice.
I think there's real value in having these conversations and just stopping every now and again and having a good conversation like this, especially just thinking about that concept of embracing the uncertainty. And there could be almost a sense of relief that people would get when they hear other people saying, hey, I feel uncertain about things as well, and here's my approach for managing that and moving forwards. So I hope this is helpful for other people. I always enjoy the conversations. I'm going to keep doing them. So if you're listening and you're enjoying it, then I really value you as the listener, and really value you, Vasish, for coming on and having a chat. Love to do it again at some stage.
Yeah, absolute pleasure. And thank you for all our listeners out there. I myself have heard a few of these physio foundations, and I've taken the Jodie's episode, one of my other actually lecturers that taught me at Monash, listening to hers, I think it was maybe a week or two ago. Again, really vulnerable, really helpful for me about those vulnerabilities she had with elite sport and things like that. And there's great takeaways from all the people that speak on this podcast for those listening out there. So please get around Luke and what he's doing, because it's been a great chat.
Good on you. Appreciate that. Where can people go to find out more about you and your work? I did a bit of a Google of you before. I found your Instagram, which was private, but you've got your Sports Med Biologic webpage. So your profile there. Anywhere else we can read more about you?
LinkedIn's always a nice spot. I probably need to do a bit more work beefing that up, but LinkedIn's a good spot. And yeah, for anyone listening that wants to reach out, please send me a message, and I'll definitely get back to you, because I quite enjoy having these conversations. And even at Blackburn Footy Club, having students around, I love it. It makes me think more about what I'm doing, and even if I'm still quite inexperienced in the grand scheme of things, there's always something to chat, and I can still learn from so many. So please reach out if you've got any questions.
Fantastic. All right, everyone. Well, thanks for joining us both in this conversation, and share the episode if you enjoyed it, and make sure you tag us in at Periton Physio or at Luke Periton. You can find me mostly on Twitter, and I think at Periton Physio is across most of the social media channels. So go and find us there. So looking forward to the next chat we can have with Vasish. So thanks very much.
Thank you very much, Luke.
So until next time, this is Vasish and Luke wishing you all the very best with your studying, professional development, and lifelong learning.